Yeah, a bit of a headache and migraine. I see in your file. Okay, that's why I put up this background today, so that you won't have to worry about certain colors hurting your eyes or anything, okay? So I want to make sure that you are comfortable and we can get you through this appointment, okay? Excellent. Now, just to start, we have modified the lighting just a little bit, just to be a little bit more softer on the eyes, okay? Is that okay for you? Okay, good. Does it feel like it's a little less painful in this environment rather than fluorescent lighting? Okay. Okay, well, we can stay right in here and we will try to get to the root of this problem, okay? So you're in for a cranial nerve exam today? That was what the original appointment was for. Okay. Well, I think today we'll do a bit of a combination. We'll do some cranial nerves, some more of the relaxing stuff that I know won't affect your eyes or make the migraine or headache even stronger, okay? Perfect, okay. Well, first I just gotta get my bag here and just take out a few of the things that I'll be needing, okay? You are the first appointment of the day. Okay, perfect. Thank you so much. Definitely gonna need that for sure. Definitely gonna need that. Perfect. We're gonna need that as well. I need this one as well. Okay, good. I'll need these as well. What I'll do is just put these right here so they don't clang or make any loud noises for you, okay? Now that I've got everything from inside the bag done, we can jump right into the appointment, okay? Are you still comfortable? Okay, good, excellent. Just put my bag just right over here. And I think just the first thing I'm going to do is just check for your breathing. Okay, check with my stethoscope here, and just to see how your lungs are doing, as well as listening to your heartbeat, okay? Excellent. You let me know if you are feeling any pain because of something that is in the office, okay, or one of the tests we're doing, okay? And we will stop it immediately and find an alternative. Okay, first off, we're just going to do this really quickly here. And if you'll just take in a deep breath for me and then just let it out slowly, okay? Perfect, and just on the other side here. And just take a deep breath in for me, and then just let it out slowly. Perfect. So everything seems to sound fine with your breathing there, as well as your heartbeat, okay? So we will just move on to the next one, okay? Are you feeling comfortable? Good, good. I will continue to ask just to make sure everything everything is perfect for you in this appointment, okay? Fantastic. Let's put those down there because I will no longer be needing them. And the first thing I think will really help with this is we're going to jump in to some sprays, okay? And for this, we'll be using a couple different scents from the spray bottle here, okay? And now, if just for a moment you will relax and listen to the water as it swishes around in the spray bottle here. And just allow yourself to get lost in the swirling water. The swirling water right in front of you, inside the bottle here. Just allow it to relax you. And know that the scents you'll be smelling soon will be pleasant as well as relaxing. And I think we will get started with the first spray here, okay? Okay, are you ready? I'm going to spray this scent in front of you, and I'd like you to tell me what scent it is, okay? There are 5 scents in all in this one bottle, each compartmentalized and ready for this. Are you? Perfect. Let's get started here. And get ready to sniff. And just take a big, deep breath. Inhale. Good, and release. Now, what does that smell like to you? Yes, correct. Peppermint. Good job. Very relaxing and stimulating to the mind, okay? So to get to the next compartment in the bottle here, we have to place the lid specifically. And we have to turn it slowly. There we are, and now we have the next scent ready to go. Now with the same specifics as the last one, get lost in the waves here, in the sounds of the water, and just allow it to bring you to a new state of relaxation, okay? Relaxing the mind and giving away to the tension in your head, okay? And are you ready for the next spray? Perfect, here we go. And take a deep inhale. And release. And what does that scent smell like? Lavender, yes, you are correct. A very relaxing scent that many use in their homes for their own relaxation. Allow the lavender to wash all over you. Now we will be moving on to the next scent. You gotta put the lid on just right here, okay? return, and there we are. We have the third scent. And just as before, get lost in the scents waves, okay? Watch that waving scent there. Though it may look like water, it is infused with the many scents you've been smelling. Just allow it to wash over you. Okay, are you ready for the third? Perfect, and here we go. And inhale and exhale. Very good. And can you tell me what that scent is? Yes, soothing light vanilla. Good, good. That is correct. This one also aids in relaxation, but also relaxes the mind as it enters in through your nostril passages and head towards the receptors of your brain. We are going to move on to the fourth now. We are going to change this up here. And turn. There we go. And once more, get lost in the water, looking liquid splashing around in the spray bottle. Let the waves take you over and give you pure relaxation. And we are ready for the fourth scent. Here we go. Gotten a little on your eye there. Okay, and inhale. And exhale. Now can you tell me what scent that was? Yes, that is right, the ylang ylang tree. It is very blossomy, very cherry blossom smells that go as well to the receptors and relax the entire body as well as the brain. Very good job. You are really good guessing. So now we are on to the final scent here, okay? And all these scents aren't bugging you or making the headache worse. They are helping. Good. I'm so glad to hear that. That's fantastic. And we will just exchange the last scent here. And we turn, and the last scent is here and ready to be sprayed. Just allow the last for the last time. Let the waves wash over you and the sounds wash over you. Loosening up and relaxing the tension in the brain even more. Okay. Here is the last spray. Are you ready? Okay, here we go. And inhale and exhale. And what was that final scent? Green tea. Yes, you are correct. The last one was certainly green tea. It was very subtle, but you were still able to pick up on it. And this also contributes to relaxation. which obviously is the theme of today's appointment. So now we will put this away here, and we will move on to the next step in our cranial nerve appointment, okay? Your head is doing okay still. So what we're going to be doing is I'm going to be trying to move your head in different places, okay? And I would like you to prevent me from being able to move your head, okay? We're going to be moving left and right, up and down, okay? That's not going to be too painful or anything for you? Okay, good. So that means we can basically do a full scope of cranial nerve today, just minusing any light exposure or any eye tests, because we don't want to strain your eyes today. So it looks like this appointment will be very successful. So now, before we get to that, I'm just going to tap on different areas of your head, okay? And I'd like you to tell me if you can feel that, and tell me which area I'm tapping into, okay? Perfect, okay. Good, and what about here? Good, and what about here? And what about here? Okay, good, and what about right here? Okay, good, and here? Perfect, and right here? And you felt those all in the right places. Perfect, okay. Well, it sounds like we might be getting a storm outside, so please don't mind any loud sounds that you hear, okay? So now, like I explained before, we're going to move on to trying to move the head in certain ways, okay? And now I'm going to attempt to move, basically be pushing on your jaw back and forth to the left and right, okay? Okay, perfect. And we're just going to try and resist it all you can. Perfect. And what about on this side? Okay, good. And we're going to try once again on this side. Good, good. And this side. Excellent. Okay. And now we're just going to try pulling it down here. Very good, very good. And we're going to try pushing it up as well. And you're stopping me from doing that too. Okay, good. And now I'm just going to try and twist here. You're preventing me. Okay, good. And we're going to try twisting here on this side as well. And nothing moves there. I'm just going to try one more time. That side. This side, okay? This way. This way. And twist. No, perfect. And twist. Okay, good. Everything looks great with that. It seems like none of this has anything to do with any of the sensations, touch sensations on your upper body, okay? And as well as your head. So we'll move on to the next cranial nerve and see if we can help you a little bit more. And I think the next part of that, because we've checked over that cranial nerve of touch and you'll be able to handle it, I figure a tension massage for the head as well as the upper neck should be a key into helping it a little bit more for you, okay? Are you okay with that if I were to massage your upper neck as well as your head and scalp? Okay, perfect. This should help reduce any swellings or tensions or pains that you have as well, okay? So I'm hoping this will be a big factor for that, okay? And we're just going to start right here. I'm going to start just the low bottom. feels good, the pressure's not too hard or anything. Okay, good. Feel free to sit back and relax. does that feel? Does that feel a little better on your headache and migraine? Good. I'm very glad to hear that. So I think one of the last things we're going to do is use our little medicine droplets to help alleviate the last bit of pain and pressure that you're feeling within your head, okay? That last bit of pain and pressure, we're going to get rid of it for you today. Going through all those other tests with the cranial nerve shows that we are allowed to do this, and you are a perfect fit for this medicine, okay? So it will consist of 3 different medical droplets, okay? Each will be placed on your tongue, and by the end of the session, essentially, it should feel much, much better, okay? It should feel much better. Okay. Are you ready to get rid of this headache? Okay, good. I thought that might be your answer, okay? I would have the exact same answer. Okay, so this one just needs to be stirred up just a little bit, okay? Just needs to be stirred up here. Just gonna make sure that everything gets in the right flavor areas, okay? Okay. So here is the first one here. Okay, here is the first one here. If you will just stick out your tongue here. Perfect. And allow it to just drop on your tongue 3 times. Perfect. And do you find that this one had a particular taste at all? Do you find that this one had a taste at all? Vaguely, okay. Good, we're trying to get the formula to the point where there is no taste at all. So thank you for your feedback. Now I'm just going to grab the next one here, okay? I'm just going to grab that next one. And the same thing with this one. This one needs to be stirred up rather nicely, okay? So please just bear with me as I stir this. There we go. Okay, I think this one is stirred just enough here so we can there we go. So now the same thing will be, this will be 3 drops of a type of relaxation medicine for migraines, okay, as well as headaches. So if you'll just stick out your tongue, and again, it will be the 3 drops, okay? Are you ready? Okay, good. Here we go. Are you ready for the first drop? Now with this one, we let it sit for us just a second. And then here comes the second. Perfect, okay. And the final drop, okay? Good. There we go. Perfect. That went splendidly. Now, sometimes, if that part of this procedure doesn't go well, then it is a complete waste and does not help with headaches and migraines. And that's why we need to test ahead of time to make sure that you are a proper candidate for this, which I am so happy that you are. 3 drops like the others. And like the last one, we are going to drop and then wait, okay? So drop and then wait. Drop, wait, drop, wait. And we'll be doing the 3 as per usual, as I've said. Are you ready for the final medicine trial? Okay, perfect. Stick out your tongue here and just let this drop. Okay, and then we are going to wait. We're just going to wait a second here. Let that sink in, let that sink in. Just let that sink in. Okay, good, okay, good. And here is the second drop. Okay, good, perfect. That is the second drop. Let that sink in, let that sink in, let that sink in, let that sink in. And the final and third drop. Are you ready? Here we go. Perfect. And we just let that sink in, sink in, sink in. Okay, perfect. And now, did you taste any of them? Only the first one you were able to taste, okay? So I'll make sure to keep that in mind for when I'm doing the recipe, when I'm tweaking it, okay? Now, do you feel it working through your head at all and helping with your headache and migraine? Okay, good, good. I'm glad to hear. You can feel it subsiding. You can feel it subsiding and going down even more. Fantastic. That is exactly what we were looking for in this appointment, and I'm so happy we did. My pleasure. Please come back anytime you have any other appointments, cranial nerve exams. Please come to your friendly neighborhood Dr.Relaxa. Okay, perfect. Well, I will just take my leave and I will let you gather your stuff so you can as well. Okay, perfect.